Tanzania has confirmed 8 cases of the deadly Marburg virus, including 5 deaths. The World Health Organization says symptoms of this viral hemorrhagic fever are like those of Ebola. The health body says symptoms include fever, vomiting, bleeding and renal failure. The African Centers for Disease Control and Prevention has also deployed a team of medics to Tanzania to investigate and implement interventions in the affected areas. Now, for more on this, we're joined by Professor Lucille Bloomberg of the Right to Care and Infectious Disease Society of South Africa. Professor Bloomberg, very good evening to you. Thank you for your time. Looking at what's happening in Tanzania and also considering that this is a virus, infectious disease, should we be concerned here at home?
So, good evening. I think the chances of Marburg spreading to South Africa would be quite remote. I think one always has to be vigilant. These viruses do occur in other parts of Africa, but I think a chance of importation would be very low.
Is there a specific climate needed for this disease to thrive?
So the reservoirs have been confirmed as Rosetta's bats. These are fruit bats that inhabit caves and I guess quite widespread in parts of Africa. And then they're transmitted to humans through contact with the bats, and then from human to human. So in forests or caves where you find these bats, the risk of Marburg may occur.
So what is it that we should know and note about this virus?
So I think for South Africans, the risk is very low. It's spread through contact with blood and body fluids of infected patients or directly from bats if one visits specific caves in areas where these bats are known to occur. So I think the area in Tanzania where this is happening is not a very common area for tourists to visit. And I think the likelihood of people coming into contact with infected patients is really quite remote. It's not a virus that's spread by just casual contact or being next to a patient, certainly not spread by respiratory transmission. So, I think it's a small area. It's limited to that area at the moment. There's another outbreak in Equatorial Guinea, but it's not an area where tourists going to Tanzania would commonly visit. And you need that direct contact. Otherwise, you're not going to contact the virus. So not like COVID.
Yeah, because that was really my next question. But when it comes to containing it and ensuring that it is properly managed within the countries you've mentioned, what will it take?
So it's really about identifying suspected cases, testing them, and tests are quite available in Tanzania in the reference lab and in many other laboratories, specialized viral laboratories in Africa, identifying the patients with suspected disease, isolating them, and then protecting those who are caring for those patients so that they don't have direct contact with blood or body fluids. And I think that's key. There aren't specific drugs at the moment. There are some experimental ones. It's supportive care. And what's now being done in many of these viral hemorrhagic fever outbreaks is to use new vaccines, some of which are experimental, but like the Ebola vaccine has been extremely successful in reducing cases in people with contact. And they're going to use some new Marburg vaccines and test them out. So that's really quite promising. And hopefully that will help to contain outbreaks. But it's identifying patients and containing and preventing transmission particularly to health workers or family members.
Yeah, because I'm reading here that what will be important is treating the symptoms to ensure survival, pretty much like what we did here in South Africa when it comes to symptoms that needed to be treated before it progresses to the other more aggressive stages.
So the symptoms of Marburg, one must put them in context. They're fever, they're diarrhea, they're vomiting, some organ failure, and eventually bleeding. have to be put in context. So, they can occur in many other diseases. So the context is contact with patients in that area or contact with specific bats in the caves. So it's not just about symptoms.
Yeah.
You must have that context. And to remind people that one of the commonest causes of fever in travelers in Africa is malaria. And that's much more common than Marburg. Very important if you're traveling in Africa to protect yourself against malaria, and always to consider malaria as probably the number one diagnosis to consider in those who've got fever, who've been traveling. Marburg, I think, in travelers would be really quite rare unless they have contact with those patients or contact with the specific bats.
Very well. Thank you so much. That was infectious disease consultant, Professor Lucille Bloomberg, saying that there's no need for any concerns when it comes to the Marburg virus, which has affected, cases have been reported in Tanzania.